Welcome to the STARS program, seniors taking active roles in society. And now, here's your host, Anita Finley.
Wound care. You know, when you fall, you get yourself a wound, and people are young and it heals. But as one ages, wounds don't heal so easily. And then we get wounds that are even more serious. When my mother was bedridden, I remember she really had a very bad wound, and we had to go to the hospital with it, and it was so serious. But there aren't many wound care centers with hyperbaric oxygen in South Florida. So we were so happy that Tina Marino, who is an RN and who's the program manager at the Wound Healing Center and a hyperbaric oxygen therapy unit at Memorial Hospital in Pembroke Pines, has joined us here today. And you are so enthusiastic. I love that when there's a professional who really loves what she does and she's doing such good work.
Yes, that's right, Anita. Thanks for having me. We're very excited about the Wound Center at Memorial Pembroke and the results we're producing for our patients.
So what kind of results are you producing, Tina?
Well, we measure results on the patients. 95% of them are healing within 28 days or less. So we're very excited about this. And this gives new hope for healing to patients with chronic non-healing wounds.
Well, tell us a little bit about what kind of wounds they are.
There are all kind of wounds in South Florida. The demographics usually are venous stasis ulcers, and these are the real problem wounds. But the majority of the patients we see are diabetic ulcers, arterial wounds, burns, and things like that. We also have the hyperbaric, which the patients can really benefit. The patients that the wounds are not healing because of a compromise in their circulation, these are the patients we're really making the impact on.
Why don't you tell people what the hyperbaric oxygen system is? A lot of people, hear that and they think, oh, that's when I go down under, deep sea diving.
Exactly. Well, we have 3 hyperbaric chambers at Memorial Pembroke. And what it does is it allows us to increase the amount of oxygen by putting it in under pressure. So patients are actually receiving 3 times the oxygen they would normally breathe on room air. And it allows for new vessels to form. It allows for the amount of oxygen to get to the wounds to heal them. So the patient comes in for a series of treatments once they're evaluated by our medical director and deemed appropriate for hyperbaric. There are some guidelines that we have to follow, but if the patient is deemed appropriate, they're able to have 20 to 40 sessions. And usually the sessions, they go in the chamber for about 2 hours. The patients are pretty comfortable while they're in the chambers, though. We have TV. They're able to listen to music. They're able to communicate with the nurse through a telephone system. And our hyperbaric certified nurses are able to monitor them the whole time.
And does insurance take care of this?
Most insurance do. According to the diagnosis and the insurance. But we have in place, if anyone wants to consider hyperbaric, we have in place a registration insurance clerk that will walk you through the whole process from authorization, calling your doctor, calling your insurance company, getting the medical necessity, any certification or documentation we might need, and we help you right through that process.
And you said something about burns. So you have a burn unit. Tell me how that all works.
Not a specific burn unit. We do handle burns at the wound center. We have a team, a panel of physicians, if you would. And when you call in and you tell us what kind of wound you have, we match you with the exact doctor that would be best to treat that wound. On our panel of physicians is a plastic surgeon. Dr. Blaine Shacken is our medical director. We also have an internal medicine doctor if it's that circulation problem causing the wound. We have podiatrists, 2 podiatrists. We have an emergency medicine physician. And we also have a general surgeon for wounds that are infected or might need to go to surgery, even though all of our physicians can handle surgeries.
And so is age a factor? I mean, can you take a very young person?
Age is not a factor for our center. Although we don't do pediatrics. So at this point, we are looking into developing a pediatric wound program in conjunction with Joe DiMaggio. But at this point, all of our patients are 18 or older, and there is no age as far as going into the hyperbaric chamber.
And have you been in one yourself?
I
you
have
done
not.
this?
I have not. Lucky enough.
No, but they say that if you want to take a test or you want to do something, go into a hyperbaric oxygen, and all of a sudden the next day you'll be so much smarter with all that oxygen pumped into your brain. That is
true. All of the nurses that work at the center are hyperbaric. The nurses who do hyperbaric therapy are hyperbaric certified, and they do go through a specialty course. And they are able to experience the chamber, but I have not at this point.
Oh, well, you have something that's on your bucket list. We're going to put that on your bucket list to see what it's like.
Yes.
Yeah, because I'm sure that some people, when they're told they're going to go into this unit, it's like, I'm going to go in there and you're going to shut this door on me, or, but I guess you all have a way of making them know it's not a problem.
Well, our chambers are mono chambers, which means one patient goes in one chamber. It's a clear cylinder. It's a very comfortable bed. It kind of slides right in. The patient, like I said, does have TV. We have a video library. They're able to pull movies and watch movies. They bring water into the chamber because as the chamber's pressurized, it does feel like you're in a plane. So you have to swallow because you might feel some popping in your ears. So we send them in there with water, and they're able to drink water while they're in there to pressurize their ears. They could also listen to music. A lot of them sleep. They like the comfort, the warmth, the coziness of the chamber. And it's completely acrylic, so the RN could watch them at all times while they're in there.
So they're not sitting up. Let's say it's a...
No.
They're lying down.
You're lying down and kind of in a reclining position. The back of the stretcher is up and almost like they're in a recliner. Their feet are up a little bit. There's blankets in there with them. They're quite cozy. Some of them really love it in there. They fall asleep. They say they have their best nap ever.
And how often? You said there could be 20 times. Is it once a week?
No, they come for consecutive treatments. We're open at the center Monday through Friday, 8:30 to 5:30. So what they do is we put them on a sequence of visits that are Monday through Friday for the 20 visits in a row or the 40. But they're evaluated during that time by the physician to make sure the wound is progressing towards healing. And then the physician determines the amount of treatments they're going to have.
It's just, that's really high tech. I think it's absolutely wonderful.
It really is. And it's a wonderful service because we're able to, we specialize in limb salvage. We want that patient that has no other choice that might be facing an amputation. Even before that, if you have an arterial wound that's not healing because the blood supply cannot get to it, these are the kind of wounds that are really changing. By healing them, we're changing patients' lives because they don't have to go for that amputation that might otherwise be necessary.
That's so horrible. I mean, what a difference in this. I'm so glad that Memorial has this. This is Tina Marino. She's an RN. She's a program manager at the Wound Healing Center and Hyperbaric Oxygen Therapy Unit at Memorial Hospital, Pembroke. If you want more information, you can call 954-883-8014 or go on the web to mhs.net. And when you get in there, then you can look up the Wound Care Center because that's Memorial Health System. And so it's a big system.
Yes.
I know it. But before, let's see, you said that you've been a nurse. And how long have you been nursing?
26 years.
And what made you want to go into nursing? Is that like you used to play with the doctor and the nurse and the little kids, I want to be the nurse. No, I want to be the doctor.
Well, I honestly, and you'll hear this from nurses all over, I think everyone has a genuine instinct to help someone. Mm-hmm. So if you could do it and you could get paid and you enjoy it, that's a win-win.
And you didn't mind the sight of blood?
No, not at all. Not at all. So I worked for the health system years prior in the emergency room and in home health. And I just really enjoy becoming part of people, finding other ways to help them. And even with the wound center, the hyperbarics being so state of the art, we use so many modalities to help them. We look at their nutrition. We look at their blood levels. We make sure their protein is high enough. We look at their psychosocial aspect. Are they getting the support at home? Do they need a nurse to come to the house to help them manage that wound? So I just like stepping back and looking at the whole of a patient. How can we help them all the way around?
Yeah, you said so many excellent facts about this. So they have to be eating properly, or they're fighting the oxygen, no matter how good the oxygen therapy is.
Absolutely.
They have to be on a very good diet, and even some of them, I guess, maybe are being forced to eat because they don't even want to eat.
Well, that's true. Some of our patients, a high percentage, have home health to support because the dressings might need to be changed regularly. So we go over and we meet with our home health team. We look at these patients case by case. What are the psychosocial aspects? Does the patient have money to buy the food? Does the patient have the transportation to the store? And we meet and we ask, can a social worker go in there and help facilitate so the patient could get groceries to have the protein to help the wound heal? So that's really, at Memorial Pembroke, we take this comprehensive team approach to healing patients' wounds.
And once someone's been healed, do they ever come back? I mean,
sometimes they do. But when they healed, we give them they walk down our hallway and everyone's clapping and cheering. They get their walk out. In chronic wounds, in patients with circulation problems, unfortunately, the wounds do reoccur. But we do a lot of teaching with patients to help them maintain healthier skin, how they could stop the problems before, but we're certainly there for them if they need to come back.
Well, I've been doing this a long time. As a gerontologist, I was always interested in the latest and the best recovery systems for people. And I remember going, this is a long time ago, to a seminar where they brought very, very famous scientists down from Boston, and they had just discovered this lotion or salve or stuff they were putting on. It was unique. And they said, you put this on the wound, and that's going to make the difference. It was very, very new stuff. It was a long time ago. But now when you think about hyperbaric oxygen, there's no comparison for that. Maybe they didn't have it then, or they didn't know about it, or it wasn't tested.
Well, it recently has come more to the forefront, and it's doing a lot of amazing things. Speaking of the salves and the creams, our nurses, myself, we're on the VAT team for the hospital. And what that does is we meet regularly and we meet with vendors that are bringing new products, new state-of-the-art treatments. And we look at them and we take them in and we clinically try them in the hospital to see if they're effective. So we're constantly looking at the latest advances in wound care to use on our patients.
So it isn't just you go into the hyperbaric unit and then that's it. There's a lot more peripheral help around that.
Right. Not all patients will qualify for the hyperbaric, but in our wound clinic, we do see patients and we use topical solutions. Our doctors debride the wounds. We're doing compression dressings if circulation's a problem. So we use all different modalities along with the hyperbarics to heal the wound, whatever's needed for that patient.
So when should someone even come to the hospital? Is this a referral from a doctor, or do they just come to the hospital and say, I have something on my leg and it's not going away?
Well, patients certainly can self-refer. And we do a lot of marketing in the community to let patients know that they could be their best advocate, that there are ways out there that they could heal these wounds that are really affecting their lives. So self-referral is excellent. Some of our referrals do come within our system, patients that have entered the system with a wound, or physician referrals. But what I encourage is if you have a wound that you've had more than 30 to 60 days, so that's considered a chronic non-healing wound, that you've tried other modalities and it's not healing, call the wound center. Come in for a consultation. Come in for an evaluation. We'll place you with that physician that is specialized for the type of wound you have, and let's get you on the road for healing.
So, you see, I think it's the problem is that people don't know when the wound is serious enough to have something done and when it's just a wound that happened. My husband hit his shin, and he's an older gentleman, so he hit his shin, and I didn't even know it was bleeding, and then I saw it was bleeding, and of course we put vitamin A and D on it, and I've been checking it, and today it's much better. So you're saying if that wound kept oozing and nothing happened, that's when you have to do it.
If it's not healing, you don't want it to get to a point where it's infected. Infections cross over. They could go into the bone, and that's when you're looking at amputation and things like that. So if you have a wound that hasn't healed, in 7 to 10 days, call the center, talk to one of the nurses. Let's get you in for a consult to make sure you're back on the road to recovery.
Yeah, it's I think it's confusing for people who aren't in your field. They don't really know what a wound is.
Right.
They hit their arm and it bleeds. And
right.
In fact, it's funny. We had an advertiser who, can't remember the name of it right now, but what would happen is there's a wound care, and you would take it and put this little stuff on it, mix your blood with it, and it would stop bleeding.
Right. Right. I remember that.
Yeah, and it's really great. We've used that. We've used it often.
Right.
Well,
let me talk a little bit about, not only is it for patients, but it's for any caregivers out there listening. If you're caring for someone with a pressure ulcer, bring that patient in. They do have to be able to come in with transportation. They could come by stretcher. They could come by wheelchair. They could walk in any way. But pressure sores, diabetic ulcers, foot wounds, burns, chronic wounds that are not healing. We also do hyperbarics for patients to help with perfusion or circulation getting to a certain area. Let's say you had a surgical flap of some sort after a surgery, breast surgery. We put patients in the hyperbaric sometimes before the treatments, and then they go for their surgery, and then we follow up with the treatment on the other side, just to make sure that the area that's going to be operating on has that oxygen-rich environment.
So before, now that's very good. That's unusual.
Right.
That's really, I can see why that would have it, because if they were weak in that area, they didn't have enough oxygen going. But I know Dr. Shatkin is also a plastic surgeon. He's been on my radio show. He's done advertising with us, and I love him. He comes on, and he's just has such a wonderful personality. And we talked about that. So after you do plastic surgery, to help heal, you can use a hyperbaric oxygen. Of course, they're not going to go into a big center, but there's some little handheld, there's little things that you put right on that with oxygen. There's also, it's all part of. We know that oxygen, the point of all this is that oxygen is very healing.
Exactly.
And you need to get it there. But I do know some plastic surgeons using it. They're not hyperbaric oxygen in the tank, but in, they have little just things that they've made for them. That I guess you have your face, it just plastic thing goes over your face. And
well, we don't do that
I know you don't,
hyperbarics at the center, but I think it's very interesting.
Well,
and anytime you're adding oxygen and you're increasing the oxygen level, it's really going to help with the heal times, the heal rates, and it's really beneficial to the wound.
And I'm going to say something, and I don't want people with stroke to go to you, but we know that people who are stroke victors can really be helped with oxygen, but I don't think that I know that you have certain classifications that you can
What we
help
do,
people
Anita,
with.
is we follow the Medicare guidelines. Although that there are studies that prove that is certainly beneficial. At our center, we follow the Medicare guidelines for hyperbarics, and those are considered off-label dives. Not that they're not therapeutic, because there are case studies that prove that they are, but in our center, we don't do those type of off-level dives.
Well, I'm so glad you're doing this. I wish all hospitals really had hyperbaric units, as you described, because if someone lives up in Palm Beach County and there aren't any, they'd have to go all the way down to Memorial. And, of course, when you really need it, you do it.
Right.
Because it's so important.
Exactly.
But I think it's a little secret. I do. I think people don't understand.
I think so too, Anita, and I think it needs to get out there because it's so beneficial. And people are at home. The wounds are chronic. They can't swim. They can't go to the beach. They're painful. They're causing infection. They can't sit Can you imagine how uncomfortable if you just couldn't sit?
You can't.
That's such a simple thing. And what we do is we really offer hope for healing. And like I said, our heal rates are at 95%. That's pretty dramatic. And we want to offer that service to everyone out there that's suffering from a wound that's not healing.
I wonder who was so smart to have been able to get that into Memorial. That must have been some history of someone who just knew it. I don't think it was Dr. Shatkin because I don't think he's been there, that long. It sounds like you've had this.
Dr. Shatkin's a big proponent for hyperbaric,
Right.
though. I don't know who actually put him in our center, but
How long have you had it there? Do you have a figure on that? I mean, hasn't been 10 years, has it?
I think it's been about that time. Because the chambers are good for about 10 years, and we just got new chambers.
Did you really?
We did.
That's
And we're having the third
big
one delivered
expense.
tomorrow. We're so excited because the word is getting out there and the results are out there. So our census has grown so much that we're able to go to now a third chamber. And we're really, really thankful to be offering that help to people.
And do you have volunteers? Do you need volunteers to help at the center?
We don't have volunteers,
I wonder
but
what they would
Anita,
do.
that's
What would they
probably
do?
something we should look into. I think the patients would enjoy that.
Right. And can you speak to someone while they're in the hyperbaric unit? Is there a microphone?
Yeah, we really, we at Memorial, we're really big on family-focused care. So that family member is able to accompany the patient anywhere in our center, including the hyperbarics. They could sit outside, they could talk to them through the phone, and they could watch the same movie with them if they wanted to.
Well, that's just astounding. I am so happy that you're here talking about this. I love unique ideas, and this is great. This is Tina Marino, Program Manager at the Wound Healing Center and Hyperbaric Oxygen Therapy Unit, and it's at Memorial Hospital, Pembroke. So let me just say that you use a broad spectrum of wound healing techniques to help patients with chronic non-healing wounds because they heal much more quickly and completely. I do know that there was a person who had I guess you call it decubitus.
Right, a pressure ulcer.
Yeah, pressure ulcer.
Exactly.
And it was right. And it was very serious. And they couldn't reach it because it was in the back of it's like the buttocks. That's where a lot of this happens because they sit too much.
Right.
See, when people have Alzheimer's or they're really sick, as you know, they don't move around much. And that's
Right.
the problem. They're supposed to be turned and they're not. And the doctor, though, was afraid because of the nutrition problem. They were not eating.
Right.
And they needed more protein. But he never suggested hyperbaric oxygen. He just said, she was in the hospital, and said that you're going to have to start eating, and you're going to have to, they turned her and all, and said, if you don't do this, you're not going to live. But I never remember his suggesting that she go into hyperbaric oxygen.
Well, even an evaluation at the wound center, and this is why it's so important to get the word out. Like right now, anyone who's listening, be your own advocate. If you or a family member or someone you're caring for has a wound that is not healed, you really don't always need the referral of your doctor. You could call the center, tell us what the problem is, what insurance you have, and the girls at the center will walk you through the process to get you the authorization, if needed. Many times, more than not, an authorization from the insurance is not even required. The patient can self-refer, come in, and be managed by our physicians there.
This is just spectacular. I mean, we love Memorial Hospital. I mean, they have been our major sponsor of our expos, but this is an offshoot of it in a sense.
This is definitely a specialty area.
Yeah.
It's the little secret that we don't want to be a secret. We want to get it out there in the community and let patients start benefiting.
Yeah, we're going to help you do that. We're just
Perfect.
Hopefully this is going to go on YouTube. But let me say also, Tina Marino, RN. How long have you? And it's okay, you can tell me. How long have you been a nurse?
26 years.
26 years.
Yes.
And you, I'm sure they're different. Like now, your level is very high because you're running the center as far as the nursing part, right?
Right. That's right. I developed a lot of experience in different areas, and then I became wound certified. And then I love really to mix the clinical aspect with the management so I could get out there and develop the business, talk to people about it, let them know our results, our outcomes, and that the facility is available and out there, and patients should know about it.
Are you doing clinical research?
We don't do clinical research on big levels, but we do watch trends. We test products along with our in-house wound specialists. So we do pilots, we do clinical studies, but we're not in any formal clinical research.
No, but you do take various things that maybe are being tested, just like some of these
Right.
salves and these products.
Right. We
that
look
are
for the best
offered.
products and treatment modalities for our patients.
But so what else do you have there that would be noteworthy for us to talk about in the wound care center? I mean,
Well, let's talk about our nurses. We missed that. We talked about our panel of physicians.
that's true. Let's talk about, are they as beautiful as you?
We have, oh, thank you, Anita. We have the most talented, dedicated, hardworking group of nurses in that center. They're all registered nurses, either wound certified or hyperbaric certified, and they really care about the patients. They go above and beyond for the patients.
What does it take to become certified in
Well-
wound care or hyperbaric oxygen?
Well, usually you have to take a specialty course and pass a national certification that's run by a board. So there is a hyperbaric certification, a national certification. There's also a national wound care certification.
But what do you learn?
You learn the specialty, you learn the theory behind wounds and how to treat them and what could be causing them and the different modalities and the disease process behind it. So it's a little more in depth than just receiving an order from a doctor and executing wound care. You kind of know the theory and what would be best for that patient.
And so people, now this is my question. There are a lot of people who have dementia. What are you doing about that? That they would not want to sit into a hyperbaric oxygen. Wouldn't that scare them?
Well, we, the physicians, deem the patient appropriate for not. There are patients, and I'll be honest with you, that might have a little anxiety when they go in the chamber. So we do talk to the patient. The doctor does come up with a treatment plan that would make them less nervous. Sometimes it can include medications if the patient wants. But most of the time, the patient comes to the center with a caregiver, and we really manage them quite nicely.
And are you putting in 100% oxygen? What? Is that what it is? 100%
It's oxygen under pressure. So what we do is we raise the atmospheric pressure. It's similar to when you go up in an airplane and the pressure increases. So what we do is we take them 2 to 2.5 times the atmospheric pressure so that oxygen can really be put in under pressure and reach the wound and help the wound heal.
Well, Tina, thank you so much. It's been a pleasure, and we hope that
Thank you for
enjoy
having me.
this. Yeah, I learned a lot. Bye.
Okay, thank you.